This is Mary Kay Clunies-Ross with the Chronic Disease Coalition. We are here to talk about rare disease. We have such a cool panel, and this is such an important topic. It's very easy for folks to say, I don't have a rare disease, why do I care? But the reality is that our families and friends who have rare diseases have unique struggles in the healthcare system, and they can illuminate the things that both work and don't work in our healthcare system. So we always have a lot to learn from. Patients often face a variety of obstacles, but the rarity of the condition doesn't make the healthcare policy insights any less real. And so we are really here to talk to advocates who advocate in a lot of different spaces and on different diseases to get a better picture of the landscape, hear some stories, and as always, be inspired to action. So just a little bit of housekeeping. Please feel free to use the chat or the Q&A function to ask questions. We'll be monitoring those, and we'll try to weave them in midstream to the conversation, but we'll also have time at the end. So feel free to do that. I am going to invite the panel to introduce themselves. I will call on everybody, though. Again, my name is Mary Kay Clunies-Ross, and you can also email me. I think our information will show up at the end. But on my screen first, I see Kelly. So Kelly, could you introduce yourself?
Hello, I'm Kelly Spearin. I'm a patient advocate for the Magic Foundation for the Division of Adult Growth Hormone Deficiency and Panhypopituitarism. I actually have multiple rare diseases, which unfortunately for what I have, they go together. And I really, really enjoy reaching out to others and helping them get the help that I needed to get help.
Great. Thank you, Kelly. Christina.
Hi, I'm Christina Tilst, and I'm actually a former hospital administrator who now has a rare disease, chronic inflammatory demyelinating polyneuropathy. And I am a member of different organizations, but one of those is Nevada's Rare Disease Advisory Council.
Great, thank you. Jerry.
Hi, I'm Jerry Langen. I am a pulmonary hypertension and congestive heart failure patient advocate. I am a social media influencer. I'm the award winner for the Advocacy Trailblazer Award for social health this year. I have worked in legislation. I've worked in different nonprofits and working towards being on a board next year for pulmonary hypertension representation. And I'm super excited to talk to you guys.
Thank you, Jerry. We're super happy to have you too. I love your story of the tenacity required to be a social media influencer. So love to dig into that. Joshua, please take it away.
Yeah, thanks, Mary Kay. Thanks for having me. So hi, everyone. I'm Joshua Henderson. I am the co-founder of the Northwest Rare Disease Coalition. We're an independent nonprofit organization supporting the rare disease community through policy, education, and programming in the Pacific Northwest, starting in Washington. We're actively involved in working to set up an RDAC in our state, amongst other kind of legislative priorities. So focus on that, and also the head of rare diseases at an organization called Pulse Info Frame, where we work on natural histories and registries to help collect data. And I would say that the theme of all my rare disease work is really around kind of collaboration and bridging the gaps between, different stakeholders, whether that's pharma and advocacy, or legislators and healthcare payers, trying to bring everyone to the table and align interests to support our community. Oh, Mary Kay, you're on mute.
Thank you. For those who haven't caught it, RDAC is short for Rare Disease Advisory Councils, and these are bodies that are created as part of government in different places, sometimes in government, that help advise policy on rare disease. And Christina is one of those who is on one of these committees, and we're really glad to have her join us and talk about that. So I'm going to start you first.
Okay, well, thank you. So I started my journey with my illness over in California, and then about a year ago moved here and saw that there was an opening on the Nevada Rare Disease Advisory Council for a patient representative. So I applied and was and became a member. And it's really nice because our focus is on helping the legislature. We were created by SB 315 during the 2019 legislative session. And we have assigned duties from the legislature of what they need for us to accomplish to help the legislation aspect of things. But we're also a platform for the Rare Disease Advisory Council in state government. We're a group that can either access them or they can access us. And we've done some of the things that we've been working on is the legislature did approve some funding for a Medicaid study to look at the delivery service models and how those are actually set up here in Nevada, which is technically considered a frontier state. It's a very rural population. There are 3 million-ish people that live in Nevada. So, you know, there may be some unique things for us compared to some of the more populated states in the country. But awareness and education is one of the things that we've started focusing in on as a committee or as a council. And it's front and center in our new strategic plan for the work that we're going to be doing. And the reason for that is we don't really know how many people in Nevada have rare diseases, what diseases they have. There's no really community. There are little communities here and there, but there's no bigger picture community that can help influence public policy. So we're going to be doing a lot of, setting up a registry. We're also doing surveys so that we can start to identify and take that data and be able to use it in making decisions for the population here.
That's great. Thank you. Joshua, you are working on getting an RDAC in Washington State, where both you and I are. What do you hope it will do for Washingtonians that is similar or different from what is happening in Nevada?
Well, a lot, but I mean, I think the amazing thing about sort of the RDACs and these councils are that they can provide a really wonderful vehicle, a wonderful platform for kind of organizing and centralizing the patient voice with legislators in that state. And I think that the stuff that's happening in Nevada and many other, North Carolina, Pennsylvania, states where there are RDACs, we took a lot of lessons learned from those groups and did kind of an initial listening tour with a number of the leaders at those groups to better understand how should this be structured. Ultimately, we didn't want to wait for an RDAC to start to bring together people and resources. So that's why we ended up forming a nonprofit organization kind of in parallel with the activities to reach our legislators and get a formal policy, a formal bill passed. But I think the notion that these can kind of start to serve within states as kind of the heart of local advocacy and connection for the rare disease community. I mean, I think that's sort of the first goal that we have, and why we were actually kind of almost a spin out from an annual conference, the Seattle Rare Disease Fair and Summit that we run, and really was an attempt to kind of continue to capture that momentum and interest and connect beyond the one day into really an ongoing project and commitment to vision and goals that we have across, diagnosis of rare disease, development of new treatments, and then, access to care and the many, many barriers that there are to doing that. So yeah, in terms of your core question, what do we hope to achieve? It's, impact across all those areas, but the challenge is always, where do you start? And RDAC is a formation of the Rare Disease Advisory Councils, I think a really core kind of pivotal enabling infrastructure that we could have in our state to support all that.
Yeah, that's great. And I want to dig in a little bit more on that, but I also want to hear from Jerry, because, we know that in drawing attention to these, causing change requires us to draw attention to the problem. And a huge part of what social media, I think, is really good at is raising issues, telling stories, and spreading awareness. So Jerry, could you talk a little bit about both your journey from diagnosis to becoming a patient, and then how that sort of turned into the social media work that you do?
Sure. I was diagnosed in September of 2018. When I was diagnosed, the first thing that I did when I was in the hospital was that I Googled my condition, and there was a lot of bad stuff out there about my disease. Oftentimes Google is not up to date on what statistics really look like. So I was having a really hard time. I was looking for somebody that was just like me, and I was really struggling with that, especially after being diagnosed with such a rare disease, and it's progressive and there's no cure. And it makes it really difficult when you're sitting in a hospital room, and you're by yourself and you're going down this deep, dark rabbit hole. When I was diagnosed, I actually had my doctor come in, and he said, "Hey, there's a girl that lives here whose story looks just like yours. She's about the same age as you, and she wants to come talk to you." And I said, "Okay." So she came in and we talked, and she made me feel so much better. And I wanted to be that girl for other people. I think she was a very pivotal point in my mental direction that I was going. I think had she not come in, I would have gotten a lot worse, like depression wise, because it was a roller coaster over a couple of weeks. So when I started sharing my story, I started sharing on Instagram because Facebook came with a lot of negativity. Facebook comes with a lot of woe is me kind of people, and that's not really my personality. So I started sharing my story on Instagram because I wanted to be that girl for somebody else. And I started realizing that there weren't a lot of pulmonary hypertension patients out there that were sharing their stories. I used to have a marketing and background in marketing, so that helped a little bit.
Mm-hmm.
And I started sharing, and it just kind of grew like wildfire. I really had no plan for it, but I was just going along and sharing my story. But really, it was for me, it was very cathartic. It was super good for me to write out my feelings and kind of document what was happening. And it really had nothing to do with anybody else. It was just I wanted to be able to look back and see where I was a year ago. And people really resonated with that. And it kind of grew. And social media has this really weird connotation. Being called an influencer comes with a really negative connotation. It makes me cringe a little bit, but it's fine. I'm very thankful for where social media has gone. It's given me a very large platform to stand on. I've spoken at a lot of conferences as the only pulmonary hypertension person in the room. I've gotten to speak with my local legislators, and I spoke to Congress last year with my doctors. I have gotten a lot of opportunity, and a lot of that is from Facebook and Instagram. I've now moved to TikTok and YouTube, and I'm just still trying to figure out what it looks like because I'm not super sure yet. But I have grown an entire community online, and that has been so cool to meet people who are going through the same thing as me, and to realize that I'm not the only person out there dealing with this disease and dealing with all of this stuff. It's also very helpful in a rare disease to see treatment that people are going through and like how they're handling it, because it's very hard to base like the doctor's experience with lived experience, and being able to ask somebody who's doing the exact same treatment as me, like what they're doing and how they're doing it and how they're navigating these issues, because they're doing it every day. And without that community, I would be in a really rough spot. It has been super helpful, and I'm super glad to have social media, even if it's not always super fun.
It's actually really nice to hear you say that, because there are definitely days where I think we all want to throw in the social media towel, and that it is breaking down barriers between people. It seems like a point in its favor. Kelly, you also have community. Could you tell us your story of your disease and insight, and sort of what you've done to build a team?
Well, I kind of I was like the biggest person against it in the beginning. And so I guess that's the reason why I had to find it as my home. So everything started with Cushing's disease, and it's probably started in the mid-90s. So Cushing's disease is too much cortisol. So it causes all of these general problems, and it takes a really long time to have it diagnosed. And unfortunately, when things started getting bad, I was an oboist in undergrad and then graduate school. And so it's really competitive, and I had to do a lot of really competitive things. And being an oboist, a musician, female, and in my 20s, there is like no better recipe for not being heard by doctors. And that's basically what happened. And I ended up having all of these other things happen at the same time. I needed diagnosis, like my jaw popped out, and I was going through a lot. So I moved back with my parents and finally worked to the point that I got a referral to an endocrinologist, and everything was coming back high cortisol. Are you stressed? Are you depressed? I'm like, no, there's nothing. There's absolutely nothing. I just need a diagnosis so I can move on with my life. And they're like, so are you on the internet? And I'm like, no. And so that's exactly the first thing I was like, I'm not going near the internet. I need to for homework. Nope, not going to do it. And so I just didn't. And then something really unfortunate happened. My endocrinologist called for me to talk about a test result, and she got my mom. And without permission, she decided to speak with my mom. My mom had other goals, and she lied to my doctor. She told her that I couldn't stop eating, and that's why I was gaining weight, and I was extremely depressed. So that sent me down, and so that meant I was lying, which created this huge barrier between it was awful. It was awful. And it made it so that whenever I ended up agreeing to things that weren't happening, and I was trying, because they were like, well, we have nothing that's you're fitting. So I was trying to make myself fit so I could hopefully, get a diagnosis and move on, and treatment and move on. And it was awful. It was absolutely awful. It was years. And eventually, believe it or not, things were so clear that my cortisols were always high. And so they were really, really bad. So I finally ended up getting a referral to one of the top places, who then treated me. I had surgery twice. And they ended up leaving me with 10% anterior pituitary, no posterior pituitary, declared me cured, but I may need Gamma Knife, and left me untreated for 10 years. And I felt like I was dying every day. It was awful. And my local endocrinologist immediately dropped me because somebody so high profile was saying I was fine. My primary care physician's like, there's something wrong with you, but I can't tell you what it is. So I had already transitioned over to another career. I'd started over in science, did 2 more bachelor's degrees and master's degrees, went on to do a PhD, and I was so sick. I felt like I was dying every day. And so what I was trying, but it was better than Cushing's. So at that point, I decided to look at everything that was like wrong in my life that and try to fix it. And so one of those things was I was thinking back to the you can't go on the internet. So I was like, I'm going to go on the internet. In fact, I'm going to go on Facebook. And so I joined the Cushing's groups and stuff like that. And you know what? People pulled me aside and they said, no, one, you're either not cured, you still have Cushing's, or you have a lot of deficiencies. I had people communicating with me, spending hours, sometimes every day, telling me this, and I just couldn't get through my head because this endocrinologist is like world renowned. So, and I was like, how do I even get help? Because I kept hearing how this person would block people from getting treatment. And so I found out that there was somebody who would diagnose and treat in spite of what she said. And so I flew across the country and I went to that person, and I learned through all of these other people how to communicate with my doctor, how to get care, and how to start to negotiate that. And at some point, people started coming to me asking questions like, how do you do this? How do you communicate with them? How do you find doctors? How do you this, that, and the other? And I decided that I was doing it so often, I might as well take a position. And there was a position that became available with the Magic Foundation. I was so excited. So I applied for it and I didn't get it. And then the person who had it before me left after a couple of months, and then I got it. And so I've been doing it for about 5 years, I think 5 years now, and I absolutely love it. I mean, like so I basically do the same thing that other people did for me. And I'm working on finding ways to, the things that I do well and I kind of get, I'm trying to figure out ways to make it so it's more available to other people. So I'm starting other types of social media outlets personally. So
Jerry, I want to go to you because you started this with I wanted to be that girl, and that absolutely grabbed me, that desire to be the person who helped you, and that's obviously Kelly's story as well. What do you see both working, and maybe if you've got some cautions for people who are new to the space in finding their community with rare, like what works, what doesn't, what to be careful of, how do you navigate some of that?
I think my biggest word of caution for most people that are getting into social media is to know that not everybody's going to like you. I get mean messages probably like 3 times a day. People are always hating on like people that are out there with big opinions. And as patient advocates, and especially as people in the rare disease space, we have to be louder because we don't have as much of a voice. And I find that the internet is not a kind place for people with loud voices.
Mm-hmm.
So I would caution anybody that's going into it to know that you're not going to make everybody happy, and you're probably going to offend somebody.
What if you're just a consumer though? Like, what if you're just a patient? You're like, I've got a rare disease. Nobody in my, area has it. How can I find my community?
I would encourage you to start small in Facebook groups, dip your toe in. There's a Facebook group for everything. There was a Facebook group for pulmonary hypertension. You have to be careful with what you're taking in. You have to take everything with a grain of salt. You have to also know that their condition is different than yours. Your body is different. The way you react to things is different. Finding community on Instagram was, I think, very positive. I started searching hashtags, and like that's what I use for my social media. So if you're looking for somebody that's out there doing it, hashtags are probably the best way to find somebody. I always tell my new friends that are looking for friends, if you are looking for people to connect with in your community, take a look at their page. See if your vibe is the same as theirs. Sometimes people are not a one size fits all. I'm not for everybody. And I know that. But like I've found people whose personalities are like my in real life friends are the same as my virtual friends. And I've gotten to meet a lot of virtual friends in real life, which has been super cool. And they are just like the people that I hang out with all the time. So you have to like pick and choose. And like, that's the same thing in like real life relationships. You have to pick and choose, and you have to be smart about who you put your time into. It's the same thing on the internet. Look for those people that are in your space, and then pick and choose to be sure that they are giving you what you need. They're filling your cup and they're not draining you. And to be smart about like how much you give of yourself to somebody that you don't know on the internet, you know. But there's huge communities out there. I started a collective. It's called Chronic Illness Collective. It's on an app called Geneva, and it's a safe space. And I like really hammer on monitoring it, but I let people have free reign so that they can talk to each other and find other people in their community space. Not everybody is in the same disease, which is cool. And it's really important to go find those places that are safe to find community.
Yeah, that's great. Christina, did you go through any of that? Was that a part of your journey as a disease patient?
It was, with my background in working in hospitals for so long, I knew how to navigate the system, but I had, like Kelly, this unreal delayed diagnosis. And I finally, from Dr. Google, narrowed down what I thought I had, and landed on Guillain-Barré syndrome. And first thing I did was look for a group on Facebook for people with Guillain-Barré syndrome, and found it. And it was a huge relief, because all of a sudden I found all of these people who sounded like me. I was cautious, and I know that we're all different, but they sure did seem to have the same issues as me. And over time, I started seeing the same questions getting asked. And I would always, when people had issues with the delivery system, I would help them with how to navigate it, because it was hard for me. And I found that it was taking other people years to do what it took me 7.5 months to do, which was get a diagnosis. And so one of the things I finally did was I wrote a diagnostic guide for physicians, so that people could take that diagnostic guide to their doctor and say, I need you to look at this and tell me if you think that this is something I might have. Can we do the lumbar puncture and the EMG so that I can determine if this is me? And I still am on those same Facebook groups and communicate, and, but I find myself today helping the new people more than learning from others, but I still learn things. My doctor was, when I finally found her, wonderful, a neuromuscular specialist, but she's never had or lived with my condition. This Facebook group, helped me figure out how to do things when I couldn't, use a zipper or button or, all sorts of things in life, because there's a paralysis that I experience. So the support groups were wonderful. In my hospital days, I actually wrote some books for hospital administrators who kept asking me, why would I want to blog and what's a tweet? So I wrote a book for them explaining this all. These were all typically older people than I was, and typically men. So I wrote this book, and it's still out there, and it's just a guide for, understanding that your patients are going to go to Google. They're going to look at social media. So how do you, as a healthcare organization, support them in finding the right places to go, finding the right groups, peer groups, that kind of thing. And it's just a pleasure today to sit back and see how active not only support groups have gotten, but the acceptance that I think a lot of the healthcare organizations and doctors, they understand it today, unlike at the very beginning.
Yeah. Joshua, could you speak a little bit to what you see changing in terms of rare disease? I think both community, but also, bridges to policy, if you'd like. And then sort of my secondary question is I know you work with underrepresented populations. Maybe what some of those implications are for those groups as well.
Yeah, I think just to build on a lot of the conversation we've been having around different communities and looking at not just within specific diseases, but also more generally across rare diseases, and that there's aspects of community and sort of shared learnings, whether they're related diseases or even like the communities that form in states around, RDACs and other statewide community rare disease communities, that it includes all rare diseases. And I think they provide a really interesting and kind of different lens to those within a particular shared disease. I think your follow-up question on kind of underrepresented groups, kind of relatedly, one aspect is, for a lot of people and legislators, there is an aspect of kind of awareness and education that, rare is actually common. Collectively as a group, rare disease represents, 1 in 10, potentially even more than 1 in 10 individuals. And so that notion of community, it's on an individual level, it's a lot, it's small. And depending on whether it's an ultra rare disease or a rare disease, there's such a variety of different prevalence and incidence, but collectively, there's no doubt it's common. It's, more than 1 in 10. And so I think that's an element of the education and awareness we try to promote, especially when talking to legislators and helping them understand what's impactful for their communities. I think Christina mentioned earlier, we don't know exactly how many individuals, within Washington, within other states, have a rare disease. However, there have been studies to kind of look at the collective impact, and that tends to resonate with a lot. It's that combination of, different people, but stories with, these aggregate numbers, which I think between the two are really impactful. When we've gone to Olympia and talked with, our state legislators, we have kind of delegations of those that, raise their hand and kind of come with us and share their story. And then, in those stories, we bridge to, yeah, this is much bigger than you think and much more impactful for your communities than you think, even if it's not as talked about, and their voice isn't always represented because, many of these rare diseases, prohibit folks from coming with us in person. So we've found it's really been important to represent those that can't show up in person. And anyway, that to me, I mean, that's one aspect of underrepresented. I think the other is really looking at different ways we can support, especially in our state, rural populations, where, again, some of these common themes around, awareness and education, a lot of the specialists don't reside in those rural areas. And so it's kind of different groups of doctors that are involved in the care of rare disease patients in those areas. So we have really spent time to try and understand the additional kind of barriers to access and challenges around education in those underrepresented groups within rare, from a rural population standpoint.
That's great. Thank you. There's a lot to unpack there. Kelly, you work with the Magic Foundation. So I was wondering if you could, because again, this is sort of a different slice of community, right? As we've talked about the online communities, we've talked about people who help us with our specific disease. How does a group like the Magic Foundation support patients and families too? Because there's a couple of different diseases within that. How can we look to those kinds of groups to support us as patients?
Well, the Magic Foundation was originally started to support parents of children with growth hormone deficiency. So it it the treatment wasn't even around until relatively recently, and it's often overlooked. So children don't develop their reach their developmental milestones. And sometimes parents just don't want to subject their child to an injection every night. So the group of parents united and formed the Magic Foundation. And then from there, they decided to create additional groups to support other diseases. A lot of the disease groups are children. There are only 2 adult divisions. The adult divisions are Cushing's disease and adult growth hormone deficiency and panhypopituitarism. There are a bunch of children's diseases. Most of them are endocrine. And we have, most of the groups have a Facebook group.
Mhm.
And each of the division consultants oversees that Facebook group. We field calls for people who reach out through the website or call the foundation, and so that results in a lot of one-on-one conversations. I have people that will call me. I have people that will text me. I have people that will Facebook message me at all hours. So, and actually, I'm okay with that for most of that, because a lot of these certain issues for specifically my group, especially if it ends up being cortisol issues, that can be deadly. So, it's okay. And the brain fog that goes with it you can just basically need somebody to walk you through every step to get a diagnosis, to get treatment, and then to get treatment that makes it so you're well enough to function. And so they have those groups. They had been putting out newsletters, but now we put out something called The Buzz. And we also have a conference every year. It alternates between combined adult and children and adult and children separate. And so there are a lot of doctors that speak, and sometimes they'll even have things on quality of life and stuff like that. So there's a wide variety of topics that are covered, and we can learn. Actually, that's how I learned what endocrinologist I wanted to go to for different things.
Yeah.
There's just a lot of patient education, a lot of patient support.
Great, thank you. Jerry, sort of 2 questions for you. One is, do you work with a specific disease group, or are you mostly sort of your individual influence? And then number 2 is, how do you deal with some of that emotional weight? Because I'm sure that when people see you, they go to you for both emotional advice and maybe even clinical advice. How do you manage that?
I am a free agent. Actually, I'm on and off contract with Janssen. I actually I speak for them, and I'm on their ad board. I also work a lot with United Therapeutics. They make my medication, and I'm on the chronic disease coalition ambassadors. I'm a free agent. I'm all over the place. I don't want to limit myself, because it also limits like the awareness of the disease. So like, I think like by only focusing on one place means that like I'm not reaching as much as I could. I do a lot of stuff with Pulmonary Hypertension Association. I spoke at their conference last year, and I am actually going this weekend to speak at a pulmonary hypertension walk in Colorado. So that's super cool. Your follow-up question was about how do I handle the emotional stress? It's a lot. I'm not gonna lie. People come to me with a lot of stuff and like it's very heavy. And people are very vulnerable and I really appreciate that. But it's also a lot. It's like I feel like there's a lot of weight that is carried with like carrying other people's stories, you know, and I try to hold honor to that and like give them space because like I just needed somebody to listen to me. Like I didn't really need somebody to give me an answer. I think I was just really looking for somebody that could relate and that wouldn't just give me the, oh, you're going to be fine, keep your head up advice. Like I just really wanted like the real stuff. So when people come to me with their emotional stuff, I try to hold space for them, but then also tell them that like it's not going to be easy. Like this disease is not easy. I'm not going to sugarcoat it. If you're looking for somebody to sugarcoat it, don't come to me for advice. That's not my personality. But people will come to me and I will tell them, you know, it's not going to get easier, but it will be different. And it's not a bad different. It's just going to look different. And your life will look different because this is a life-changing diagnosis. And I try really hard to like leave social media in social media. It's hard sometimes because a lot of those stories do hit like my heart. They pull on my heartstrings, but I really try not to bring that into my real life. You know, I try to separate the two. I'm very good at compartmentalizing. So I try to put it all in a box and put it away because I also have a family. I have 2 kids and a husband, and I try to be emotionally available for them, and I can't emotionally be available for everybody. So having boundaries is a big deal. And in order to carry all of that weight and then still be emotional at home means that I have to be very smart with how much I'm putting into social media. You know, like I stepped away a lot this year because I needed a little bit of space just mentally, like it was just too much. But I also don't want to walk away from the page because there are so many people who come to me and they're like, I am like, you've restored my faith in God and you have given me hope when there wasn't hope. And a lady got diagnosed because of one of my posts, which was crazy.
Wow.
So like there's a lot of great stories and the great always outweighs the bad for me. And I won't walk away from it until the bad outweighs the good, you know?
Yeah, that seems like a great threshold to have for all of us, probably. We've gotten a couple of questions in the Q&A, and I want to throw some of this to you. I'll try to kind of condense a couple of them. And Christine, I'm going to start with you because some of them are about COVID safety in particular in the healthcare setting. You know, we are starting to see a resurgence of COVID. We've got RSV. We've got vaccines for some of these. They may or may not interact with, you know, with some of the medications. People with rare disease are, you know, more at risk. So there's a lot going on there. What do you wish people were thinking about as we sort of head certainly into flu season and healthcare settings and rare disease patients and COVID? That's a lot.
Okay.
But wherever you want to
Well,
start pulling the thread.
So working in healthcare, one of the things that I got used to was getting my flu shot every year. That was expected of us so that we're not spreading it around our patient population. My condition is autoimmune related. I have a compromised immune system. I was initially told by my doctor when COVID hit not to get any vaccines for anything because it could trigger the response that my body had already made, which was to attack my nervous system. So I have damaged nerves, partly due to how long it took me to find a doctor who would actually believe that something was really wrong with me. And so I now have gotten a flu shot, or not the flu shot, but I have gotten the COVID shots. I didn't get the last one because each vaccine is a risk for me. And so I'm personally trying to weigh, you know, when is it bad enough for me to go and get another vaccine? because it's a risk. My condition is brought on by either viral or bacterial infections mostly, or vaccines. Vaccines trigger Guillain-Barré syndrome, which leads to CADP like I have. So it's a personal decision. I worked really closely with my doctor for when she felt the risk was better for me to get the vaccine than it was to not get it. So, I've worked through it. I actually had COVID and was tired one day and had a little sore throat. So, I don't know if it's my treatments that helped me get through it that way or not, but it's definitely a personal decision. I try to stay away from too many people, and especially people who I know have not been vaccinated or who have illnesses. I just try to stay away.
And so I would also assume that masking is important to you and to the people around you as well.
Right. And as we're looking at this new variant that's kind of hitting us right now, going into the fall, I've been thinking, okay, I've got to go dust my mask off and get ready to start wearing those again when I go out and shop and things like that. Because as we're seeing the increases that we are seeing, I know as a patient that I need to start protecting myself, and masking is my next step.
Great. Joshua, do you see RDEX as being, part of that, policy making around, COVID decisions and shutdown decisions, public space decisions? Is that, can legislators and departments of health look to RDEX maybe to potentially help advise on some of those?
Yeah, it's interesting you say that, because the comments and the questions and this discussion is like, that's the exact framework that I start to filter through. Is this okay? This is a challenge and an issue for the rare disease community. Does this flow through? Are there levers from a policy perspective that can be pulled, or is the solution a better fit for a non-policy sort of educational kind of awareness campaign, or are there levers policy-wise to pull in and support education and awareness? I think that's the kind of the constant thread of in our organization and how we process these kinds of challenges, is really just kind of systematically look, okay, here's the problem. What are the potential solutions? And sometimes we'll bring together stakeholders to meet around that and come up with really diagnosing what are the issues and then what are potential solutions. Does that flow through a policy opportunity or through a non-policy kind of mechanism? And then, can we kind of spearhead a means to connect the people who are really interested in driving change around that? So I think, it's a non-answer explicitly to your question around, are there policy means to address, COVID impact for the rare disease community? But that's the sort of framework we use to think about whether there are and how we can activate people in our community to work towards a solution. Again, whether that means putting forth a bill, working on a budget proviso, or if it's, we should set up a web page and bring together resources. We should be looking at how we can educate primary care physicians or others in hospital settings to, to bring awareness to clinicians around, these issues.
Yeah, I think that really gets to it. And I'll just put in a little policy plug on behalf of our policy director, Nathaniel Brown. One of the things that we advocate for is expanded health services. During COVID, when we were able to sort of open up telehealth as a more common avenue for care, it obviously reduced travel, which was really important to a lot of people. It kept folks safe. If you're immune compromised, you do not want to go into a clinic where other people may or may not have COVID. So symptomatic or asymptomatic, right? It doesn't mean that people are being careless, just that there was disease we didn't have any immunity to circulating. What we also want to see is telehealth that provides the provider the same reimbursement rate as they get when they see patients in person. And that will obviously help incentivize more providers to give care that way. But as we look at those policies, one of the many reasons besides access for folks who are rural care, access to specialists who may not be in your area, is also protection from infectious disease for our rare community as well. One thing that we haven't really touched on, which I would like to before we leave, is innovation. I think one of the challenges that we often hear from, Jerry's an ambassador, Christina's an ambassador, we have other ambassadors who have rare diseases, is the next needed treatment. We can't just level off on innovation and treatment development now, because A, we're finding new things, and B, we just need new and better treatments. And that is a very, very hard thing to do in the rare disease space. Even if 1 out of 10 Americans has a rare disease, it also means that that there can be rare and, as Joshua mentioned, ultra rare diseases where there may not be many treatment options. So I'll just sort of throw this open to anybody. Are any of you active on sort of new treatment development, or have thoughts or experience that you want to share that will help other people understand the importance of it?
It's not an issue of new treatment development, but I'm actually using a treatment that is carried over from diabetes. So basically, I'm panhypopituitary, which means I have to replace all hormones. I could not get stable on cortisol, could not get stable. And they think that's the reason why I have elevated intracranial pressure. So if my cortisol goes down, intracranial pressure goes up. They don't think I have a problem with it. However, I was at home, I couldn't work. And people kept pushing me to try and get on a pump, which I didn't want to do because I was really scared. I thought, I'm not going to be able to get treatment if I have to go to the emergency room or anything like that. And eventually I was just to the point where I was so sick that I thought, it doesn't matter. I'm going to do what I have to do. If my doctors have problems with it, I'm going to get another doctor. I mean, how many primary care physicians are there out there? How many endocrine? And so I finally just decided to go for it. And I actually ended up getting better care because of it. I've been on the pump for, it's been over 3 years now. So I use an insulin pump, and it has Solu-Cortef in it, which, by the way, right now they aren't manufacturing. So there was an unannounced shortage. And so I've been using this. I'm vocal about it. And my endocrinologist, actually, I really, really liked him. When he put me on it, he said, the first thing you need to do is you need to get into the pump groups, because they're going to be able to help you. It's so personalized. It's so individual.
Yeah.
And you know what? This has given me my life back. After getting on the pump, I suddenly started to be clear-minded. I was able to get a job, and I've been working to get my life back. So one of the things that I do is I have to be very careful, because everyone, if they think, oh, if I get on the pump, my life is going to be changed. And really, that's not going to be helpful. And so, but I do look out for other people like me. And I speak up, and I speak up in frankly all of the groups. And that's one of the things that I find is helpful. It helps other people get care. So if there's something that's related to another problem that I have, I'll say it in those other groups, because then those people think, I hadn't even thought of that. And then they'll come to the group, and then they'll get, it's been very effective for me, and it's actually helped me get better treatment. And this is one of those things that when I first started using the pump, and now it's only been a couple of years, it's been around for much longer, but there were not many endocrinologists in the United States that would treat with it. And now there are increasingly more. And so I'm finding people all over the place that use a pump for cortisol. So
That's great. Yeah, so innovation in using maybe even existing tools to treat and to respond. Christina, you've got some experience in this.
Yes, so I have, for the last couple of years, I've been participating in a lot of studies or surveys where pharmaceutical companies are trying to address my treatment. My treatment is IVIG therapy, which is very expensive. It hooks me up, I get hooked up to a IV pole, and I've been over 4 days, 3 days, and now I'm down to 2 days, and hopefully we'll see if we could stick with that or go back to 3. But it's like $50,000 right now every 6 weeks. So what I'm seeing is a lot of pharmaceutical companies looking at how can we get the cost of this stuff done, this treatment, and the amount of time it's so disruptive to life. My world revolves around my treatment schedule, and they're looking at ways that I could give the treatment to myself. That studies, would you be able to stick yourself with a needle, or all of these different questions. And so I'm really intrigued by what I'm seeing from an innovation standpoint, and just waiting for somebody to come up with something better for me, because I am tired of getting hooked up to an IV pole every 6 weeks.
Yeah,
2
I bet.
days.
And I want to add, I mean, you mentioned, Christina, the surveys. I mean, that's real world data, and that's what I like live and breathe every day, which is helping to collect these real world experiences, the stories that come up in Facebook. It's a systematic way to capture the data of the real lived world experiences with treatments, what the outcomes are. And there are often opportunities for patients to participate in that research, and it's a way to give voice and give a story through data. But that data, when it's collected, can be used to accelerate the development of new treatments, to help pharma companies or advocacy groups better understand the natural history of the disease. Everything from situations where there are no treatments on the market, and even no pharma companies that are developing treatments, all the way through to those where there are treatments, and it's a matter of kind of better understanding where are there still gaps, whether it's in quality of life or in adherence, all of those aspects.
And I'll chime in too, where Kelly and I are twinning. I use a repurposed insulin pump. My disease is the rare treatment. Everybody thinks it's diabetes. It's very confusing. I can understand. I keep my sites longer than most people. I keep them like weeks, hopefully months at a time, which really sucks. But I'm actually in a clinical trial. So if we're talking about like being on the forefront of innovation, like being in a clinical trial has been so cool. It's been really cool to see what a new drug is going to look like. It's one of the breakthrough drugs in the pipeline for pulmonary hypertension right now. So I get to be on the inside of that. I've spoken with ICER, and am hoping to speak with the FDA for approval for the drug that I'm in clinical trial with right now, to try and get it on the market because of how well I'm doing on it. So innovation looks like volunteering and volunteering to be in the clinical trial is part of it. It's not super fun to be a science experiment, but it has been such a great result for me that like I would encourage everybody to do it, because like I have been on the drug since November. I've been in clinical trial since last January, and I have had the drug for almost 8 months before it hits market. So it's been really cool to see like the development of that, to like be able to critique like how it should be delivered, what they should tell patients when they're delivering it. Like they want to know all of those things, and it's been super cool to be able to be like on the forefront of that. So I would encourage you that if you're looking for innovation, that you should ask your doctor or look at organizations that deal with your rare disease about clinical trials in your area. I travel really far for clinic anyway, but it has been well worth it at this point.
Yeah, that's great. Thanks, Jerry. And we could absolutely, and we probably will, quite honestly, dive into this at some point. Lauren, I think we're seeing your whole screen. Because there's so much to explore here in terms of this. So we've got some resources up here. We'll close out, but I want to give everybody one last chance to all of our panelists to say anything that has come up for you. If you have any tips or tricks or resources, we can also put those out as well. But this has been such an interesting session, as it always is. I always want to go longer on this one in particular because there's so much to explore. But I'm going to start at who I see on the bottom of my screen, which is Joshua. Joshua, any last words?
No, I mean, this has been a great conversation. I think for me, the kind of common themes I've heard, whether it's conversations with finding your doctors or finding your community, it's finding the safe space for those conversations, even if that safe space is an individual like Jerry or Kelly or Christina. And then again, for me, just that notion of collaboration across diseases, across geographic locations, is just so important and so needed in this space, in driving innovation and getting those stories out there, getting the impact with legislators or others.
For sure. Thank you. And not being alone. Christina.
I would say it comes down to advocating for yourself, whether it's with your family members who are trying to take care of you when you need help, because I used to fall all the time and somebody'd have to pick me up. So advocating with family members or caregivers, your physicians, and it goes all the way up to, what the role of the RDAC, influencing public policy. Too often when I was in the hospital, public policy would come down and I'd have to figure out, how do we implement this with still making sure the patients are safe, because some of the policy wasn't really written very well. So me now being a patient, I see a very important role in contributing to public policy, because ultimately it's going to affect me as a patient. So just advocate for yourself everywhere.
Great. Thank you. Jerry.
I would say that if you are recently diagnosed and you are looking for community and you don't find somebody who is loud in your space, I would encourage you to not be afraid of the sound of your own voice, and be loud and advocate for yourself and be the voice and be the light for your community if there's not one already.
Great. Thank you. Kelly.
I think it would be know that each and every specialist approaches things differently, both in terms of treatment, diagnosis, and interaction with the patient. And so it's really important to find the right one for you. And so if there are times that you just don't feel like you're being heard, even though you're a rare disease patient, it doesn't matter. Find someone else. Don't look at it as, I've had to go through so much, it could be worse. No, but it could be so much better. You don't understand. It can be so much better. So don't just look to, hey, I have to go to this big name place with this big name person. That may not be the answer. And also know that whoever you need for diagnosis may not be the person you need for treatment, may not be the person that you need for treatment later on. You may need to switch it up multiple times or even go back, and just to not try and keep the communication clear and not burn bridges, and just be open-minded.
That's great. That is all great advice. Thank you, everybody. And, frankly, I just want to close out by saying thank you to everyone. And for anyone who's listening, If you can get a COVID vaccine or any other vaccine, flu vaccine, please do that. You protect yourself, you protect other people, and follow local guidelines and CDC guidelines around masking. It is safe and it is highly effective when we use the N95s to protect other people and lengthen lives. And thank you everybody for doing their part to help keep our community safe. Whether you've got a rare disease or a common disease or maybe no disease at all today, it makes a huge difference to the spread in our community. So thank you everybody and have a great day.